Hello. Hey, Dr. Tassone here. Just wanted to do a Facebook Live. It's been a while. Excuse the hat and the golf clothes. I'm on vacation and I actually just play golf. But I thought it would be a good idea to start talking a little bit and having another one of these discussions about the Essure removals because I'm noticing that a lot of women are having these done and aren't I don't think are necessarily either getting the whole thing explained to them properly or they don't know what to expect when they go into it. So I'd really like to have a brief discussion, maybe answer some questions on those that are undergoing Essure removal that might have a pending removal coming and are just having tubes and coils removed, because to me, that's a much different process than having the actual hysterectomy. And I just put out the Essure Bill of Rights, which is going to be about 23 to 25 points, I think, that you guys can have to bring to doctors' offices, and I'll put them all together over the next probably 4 weeks or so, and I'll put it into one PDF so you can have them all together. The one that came out today was a little bit confusing in the sense that it said you don't need a hysterectomy. And what I meant by that was I think a lot of you go into it thinking that you have to have a hysterectomy. Probably in most cases, the hysterectomy is what's going to make you feel ultimately better, but it's not something that you have to have. The point being, though, is if you decide to have just the coils and tubes, you really need to have a specialist. Now, most OBGYNs will probably tell you that they don't, or that they know how to do a salpingectomy, which is true. 99.9% of them can do a simple salpingectomy, but they don't know how to do a salpingectomy when there's an Essure coil in. And what I mean by that is most of the doctors that are doing these are doing them not with what they're either doing is they're cutting the tube open and they're pulling the coil out, or they're cauterizing the coil at the base of the tube where it connects to the uterus, and then they're cutting it to see down to the coil, and then once they see the coil, they're teasing that end out. Either way, my guess is 95 to 99% of these coil-only removals are being pulled on. That not only leaves you at an increased risk for fragments, but it can cause increased risks of leaving the pet fibers behind. I had 2 women email me this week that are still having symptoms, which is obviously something that can happen. Even with a hysterectomy, you could still have some symptoms. But I think with a poor coil removal, you're definitely leaving yourself open for a second surgery. And I would say about 25% of the women so far that are having coil removals are having a second surgery because they're either having persistent symptoms. Things that I'm seeing are pieces left behind, coils sewn into the vaginal cuff, doctors doing hysterectomies, but they're only doing a vaginal approach, which is the wrong method to do for a hysterectomy specimen. So you just want to make sure of a couple of things. One is, hey, Renee, one is you just want to have, if you're going to have the hysterectomy, let's talk about that first. You want to have a hysterectomy that's done laparoscopically, meaning cameras in your belly button. Also, you want to have a hysterectomy where you have the coils removed still attached to the uterus. Some doctors, even though they do laparoscopy, will leave the tubes in, and I don't know why, but they do. So you really have to make sure that you tell your physician you want to have your coils removed, but you want to have the tubes still attached to the uterus. So that's with a hysterectomy. So anything laparoscopically assisted, whether it be robotic, straight sticks, however they do it. I'm also not a fan of a supracervical removal, meaning they cut the cervix off at the level of the uterus, because the only way to then get that specimen out of the belly button is to have a morcellated specimen. And it's not power morcellation anymore with the device, but it is where we still have to cut it into little pieces through the belly button to get it out. And there is an increased risk in having that done where you're going to have pieces left behind, even if it's in a bag. So I just don't do supracervicals unless it's just demanded by the patient. So let's talk about, and feel free if you have any questions to just chime in at any time. Let's talk about what we do with the salpingectomy. The first question you need to ask yourself is, why are you having a salpingectomy? Most women, I'm assuming, that want the salpingectomy done don't like the idea of having a hysterectomy. Probably 9 out of 10, 8 out of 10 patients that I see have pelvic pain or severe bleeding when they come in with these coils. And in most cases, that's not going to resolve with a simple salpingectomy. In most cases, you're probably going to need a hysterectomy to have that specimen removed. So what we want to do is we want to make sure that if you're having the coils removed, that you also have the tubes removed. You never just want to have the coils removed by themselves, because that would definitely involve pulling, shredding, fragmentation, stuff like that. If you're having a reversal, I'm not really talking about reversals, but even in my opinion, reversals, you probably need to have a portion of that tube removed, and then whatever piece you have left on the end reattached to the uterus. I think it's still debatable whether reversals are worth it or not. I know for some women they are. They've had great results. They've gotten pregnant. But I think my theory right now is that the tube is already damaged because of the coils. To try to reattach a damaged tube to the uterus probably won't necessarily result in a good result for you. So I think I have to go answer the door, so I'm going to break talk here. But I don't think it's necessarily the greatest thing for you to have it done where you have to have the coils removed unless you really are wanting to do it for a particular reason. I think that you need to make sure that if you're doing just a coil removal, that you also have a doctor that is very comfortable doing not salpingectomies, but Essure removals. And what I mean by that is that you have to have a doctor that is really adept in removing the coil, the Essure coil with the tube intact. Gladys Campos has a question. If you have a salpingectomy, does specimen automatically go to pathology, or do you have to request it? Anytime you have a surgery done in the hospital, they have to send the specimen. They should send the specimen to pathology. You have to have that done so that you can identify the coils and the tubes. The problem is you're not going to have, if it's done correctly, women will send pictures in all the time. You see them on Facebook of just the coils. Well, the only way you can have just the coil is if they pulled it out of the tube. So you should never see somebody's coils online, because if you do, that means it was done incorrectly, because you can't get those coils out without pulling on them. So what you should see in a proper salpingectomy is a picture of the tube with a piece of the uterus still attached to the end. And you don't necessarily even see the coil because it's inside the tube. That, to me, is a proper procedure. So if you're seeing specimens where you just have a picture that a patient posts or a cup with the coil in it, that's the only way you can get that, is to actually have the coil pulled out. So I would be a little bit nervous about that one. So I put this on the other couple of days where I've been posting the Essure patient bill of rights, that you shouldn't have a procedure done, or at least I wouldn't do it, unless they've done about 30 cases. And the reason that I say that is, obviously somebody's got to be the first case. Do you want to be the person that's their first case, is the question. And it's debatable. Some of you guys have to travel long distances to have it done by somebody that knows what they're doing. Some of you just don't have the means to do that, and you're willing to take that on in order to have the surgery done at all. So, and I understand that, but to have it done by somebody that doesn't know what they're doing, and you're the first case or the fifth case, I don't think you get really good at doing these until you've done about 30 of them. And I'm not talking about hysterectomies per se, I'm talking about the salpingectomies. So unless you're with somebody that's particularly adept at these, and so somebody asked me, how do you know? Well, point blank, you ask. So most doctors, I have to believe, are going to tell the truth and say, well, I've done, 10, or I've done 15. Or if they say, I don't know, that's usually because they haven't done any and they just don't want to tell you because they don't want to lose you as a patient. If they say they haven't done any before, but it's an easy enough procedure, that's probably not somebody that I think you would want to go to. And that gets me to another point, is on a lot of these state Essure boards, they have a list of doctors that have helped women in the past. That list doesn't mean that those doctors know how to remove coils. It means they're willing to help, which is great, but it still doesn't necessarily mean that they know exactly what they're doing. So what I always tell women to do, and I'm going to put it here right now, I'm trying to get women to sign up on my website, removemyessure.com, because I'm trying to group into zip codes. So let's say we have a zip code where in Denver right now, where we have 20 women who really want these Essure coils removed. Well, what I'm doing is we're trying to focus on physicians like myself who are in a gynecology-only practice or that have interest in learning new procedures. And we're going to go to those doctors and say, hey, doc, we have 20 women in Denver that really want this procedure done. And if you take Dr. Tassone's class, he can come out and help you do the cases. You can get good at this, help these 20 women, and then we can start referring more clients to that physician. So if we have more women signing up through the website at www.removemyessure.com that sign up, then we can focus on those areas first. So let's see, Renee had another question. Sometimes pathology removes tissues from the coil before releasing. Pathology will not take the coils out of the tubes. 99.9% of the time, they will not do that. They may cut the coil and they may cut the tube in half or section it a couple of times, but they will not take that coil out of there. That's just not something that they do. If you see the coils in a cup, that means they were taken out like that in the operating room. If you see the coils on a blue towel or a green towel and the doctor took a picture of them, that means that that's what it looked like when they pulled the coils out of your tubes. And I'm sorry, but that's just the only way that can be done, because those coils 99% of the time are so stuck in those tubes because they've caused an inflammation that there's really no way to get those out without pulling them out. So that being said, like I said, let's try to get women, as many as we can, to sign up on the Essure, removemyessure.com website, so I can start targeting cities where I have a higher density of patients that want to have these out. I can have doctors come in and start removing these that are at least knowledgeable now in the method, to know how to do the workup, to know how to do the coding, and so that women don't necessarily have to keep traveling to have these done with myself or Daron or Sills or somebody that's been doing these for a long time. Currently, I have developed my own method. I think there's a couple other doctors, Ed Daron in Atlanta and maybe Scott Sills or Eric Sills in Carlsbad, that have their own techniques. And I'm not saying one is better than the other, but I just know from the 350 or so that I've done that mine do work. Does it have to be women who still have the Essure implanted? What do you mean? What does it have? To have the salpingectomy or to have a hysterectomy? In women that already had the coils removed, that are still having symptoms, it's going to be impossible to say what's causing those symptoms and what's going to make you feel better. Now, if you're having heavy bleeding, if you're having pain that is elicited when you have a pelvic exam and it's definitely coming from the uterus, then it's probably beneficial at that point to have the uterus removed. No, you can sign up at the website if you want doctors in your area that are comfortable taking out Essures, or at least dealing with Essure-related complications. Because what I'm seeing right now is a lot of women are going to their doctors and they mention the word Essure, and they kind of get that glazed look in their eye, and they kind of shuttle you out the door, as it were. So I think that what a lot of women right now are dealing with is just kind of how to approach their doctors and how to talk to their doctors. And I think my goal here is to really make it easier for you guys to find a physician in your area. I have a nurse that's going to be gathering this data when you guys sign up and gathering these demographics, and then she's going to we're going to sit down together and we're going to look for physicians that are interested in this removal procedure, and she's going to go out there for me as somebody that's familiar with the procedure, familiar with the medicine and physicians' offices, and she's going to start working on getting these physicians interested in helping you all in different states and in different zones. So what I'm going to do, because I put this Facebook Live in my group, it's important for you guys to share this as much as possible. I think if you can share this video, if 100 of you shared this video, it would be extremely helpful. If you could put it on the link to the video in the, or at least in the main page, that would be great. The problem is if we put the link and they're not members, they can't get to the video. I think if we can get more women to join this particular website where I can say things that I want to say and not worry about being censured or disagreed with by some of the admins who don't think that what I'm saying is appropriate because they're afraid I'm scaring patients, even though the reality is I'm not trying to scare people. I'm just trying to get the truth out there. And I think it's really important that we do it the right way. So thank you, Jeanette. That's very nice of you to share this. I really appreciate it. The other things we can do is share it with your state pages, share it with the groups of people that are interested, share it with any people that you know of that might have that might want to have the coils removed, or share it with any news stations that might want to take interest in doing this. I know sometimes it's hard because you just don't know where to start, and I get that. I know also one thing I wanted to talk about really quick was my office, because in the last 2 weeks I've really had a hard time. Things were running pretty well at the old office, but because of the Essure issues and because of the censorship that I was getting and just kind of some difficulties doing things the way that I wanted to do them, we parted ways. And in parting ways, it takes about 2 months for me to get on some insurance plans, sometimes 3 or 4 months. And I tried to do it in 2 weeks, and it was really hard for Kim and hard for surgery scheduling to stay up with what was going on. We're slowly getting on the plans. We're slowly getting everything back up and running. I would imagine, and then by July, everything will be perfect. In the meantime, actually one of the doctors that I'm training right now to do Essure removals is Dr. Catherine Lander, who happens to be my wife. The nice thing about having her on board is that not only can she see women that might be interested in seeing a female provider, but she's also able to help me in the OR. I'm able to help her. And if it's an insurance plan that I'm not taking or that I haven't contracted with, because she's in a bigger group, she's more than likely to be on that contract. And so any of these cases that she's doing, I'm in on. So you get 2 of us doing the procedure at the same time. Yeah, we don't argue too much, I promise. We actually get along really well. So, but it's really great having her on board. I hope more doctors start coming on board. What questions do you guys have? Thank you, Stephanie. Really appreciate that comment. Thank you for listening and watching and learning. I'm really trying to reach as many women as I possibly can. I'd like to see this group go over, 1,000 women if I can get that many. Joni, major kudos. Thank you very much. The new office is, the other thing is it's in a plastic surgery office. I'm just renting out space from them. They're great guys, but my name isn't on the door yet. I've had a couple of people get frustrated about that. It's called Breast and Body of Austin, but I will have my name, Tassone Gynecology, on the door probably next week. Yes, so what you would do if you have a doctor like Michael Gavigan and Parker, I would love to have somebody like that on board. what I've been finding is you can share the website with them. They can sign up. There's a click on the Remove My Essure website. There's a click that they can do. There's a click that www.removemyessure.com where for patients and one for providers. If the provider clicks on it, it will ask them for their name, information, zip code, and also their license number so that I know I'm actually dealing with a physician, and then I'll send them more information. Unfortunately, what I've been finding is a lot of these docs, you'll give them the information, and unfortunately, they won't take the time to look at it, because what I'm trying to say is a lot of physicians feel like they already know what they're doing. And unfortunately, and I don't mean this in a bad way or some sort of, holier than thou way, but they just don't. It's not something that's common. It's a little more difficult to deal with, and doctors don't like to admit they don't know how to do something. I've sent all my stuff to your office to get this going. I will also sign up and share this video. Thank you, Erica. Like I said, I'm out of the office this week, but starting next week, I should be able to get back and read those records. And then what happens is, for out-of-state women, you send me your records. I like to have a copy of a recent x-ray, a recent exam. If you have your operative note from your Essure implant, that would be great. I look at the records. I have Kim call you. Kim will call you. She will get your chart open in the medical record system. Then I call you and we'll go over what I'm seeing and then what you want to have done for the surgery itself. And then we get it scheduled and you come out and we get it going. Any other questions about anything? So if you want to get quicker responses, the best way to get in touch with the surgery scheduler is right here. surgery@drshawntassone.com. If you're not getting an answer there, I will put up another email in just a second. That's Kim's email at kimh@drshawntassone.com. Kim's usually really good about getting back to emails. Obviously, it might take her a day. You can go to this link for Natalie just posted. Natalie's the nurse that's helping me with these other physicians. So the more people that get out there and sign up on the website under the patient section, the more women we can get. I think we have a few hundred. And the more we can get, we can group women into those demographics. This is Kim's email. You can email Kim and she'll get back to you within probably 24 hours. Otherwise, you can always put up, you can go to this website and just sign up. Or you can email me directly. And I'm usually really good because I'm always on my computer. And you can email me right there if you want. Jenny's happy because she's going to have hers out soon. And everybody should have that. One of the first things that I put in the Essure Bill of Rights is basically that you should be listened to. You should never have to go into the office and tell a physician. I've seen it, a few of the other women on the sites, and even some of the admins recommending that you don't talk about the coils and that you focus on your problems. And the problem that I have with that is that you should be able to talk about the coils, and you should be listened to, and you should be heard, and it should be understood. And if you don't tell the physician that you have coils in, then they might not do the right thing, and they wouldn't know, because they wouldn't know what to do. So if you know about the problems with the coils, if you know that you're having problems, then by all means bring it up, because then you'll also know if your physician is supportive of you, and you don't want somebody doing surgery on you that's not supportive of you at all. Jennifer always makes nice comments about me, and I promise it's not a paid endorsement. She's just super nice. Actually, Jenny was one of the first patients that I ever did, probably close to 2.5 to 3 years ago. And I wish she would post more pictures of herself, because what a transition she had from having the bloated abdomen and, just feeling horrible, and to obviously, I mean, I don't know, you can tell everybody, Jennifer, how much weight you lost. I think it was 30 pounds. She's like, she was pretty to begin with, but she's amazingly beautiful now. I'm a lot happier. And I think that's really what the goal here is. It's to make you feel better. It's to help you feel better. It's not necessarily going to make you gain weight. I know Jennifer tried really hard after she had the coils removed, but I think having the coils removed sometimes makes it easier for you to lose weight. And it's not just going to come pouring off, but we know that bloating is an issue, and we know that bloating does get better within days usually. So what Angela, one of the admins from the main page, is agreeing with me with is she and I are kind of on a mission right now to teach you guys how it is that you should have the coils removed. And one of the things that's mildly frustrating right now is that there's so many women that have already had the coils removed, or have appointments or have surgery scheduled, and you try to tell them, how is your doctor removing the coils? And they'll say laparoscopically, and I say, no. How are they removing the coils from the uterus? So many times I hear, I don't know. And I'll say, well, you need to have the doctor draw you a picture. They should be able to show you exactly how they're going to remove the coils. And if that picture does not show them digging into the uterus to remove part of the uterus to get that uterine piece of coil out, then that's just, in my opinion, not the right way to do it. Obviously, that's my opinion. But what happens is women get angry with me and say, well, I really trust my doctor. And that's great. Like I said, most physicians are well-meaning and they want to do it. They just haven't had the exposure to it yet. And I just don't think that you want to be the person that they experiment on. So the question is, do you want to have them removed bad enough to where you're just going to do it any possible way and roll the dice, or do you want to have it done right the first time? Because I can tell you, I've had a handful of women that have come out to Austin from different states that have had bad removals, and it's never good. I mean, I've seen 5 or 6 pieces. I've had to do, one patient I had to do about 12 x-rays in the operating room to find the pieces, and it's not easy. It's longer under the anesthesia, and it can be impossible sometimes too. And you can talk to some of the admins at the main page that actually have morcellation where the pieces are everywhere, and you're just never going to get those out. So you only have one chance to do this right the first time, and I would really encourage you to do it right the first time if you can. So we're coming up on about 30 minutes. I don't want to bore everybody, so if there's any questions, I'll hang around for a few more minutes. If nobody has any questions, then we'll probably end this for today. Remember to share this website wherever you can. RemoveMyEssure.com. And tell women to sign up. The more that sign up, the more that we can get a demographic based on zip codes, the more that we can target those cities and those states that have the most women that are eager to have these removed. And numbers talk. If I can go into a physician that lives in Denver or Chicago and I say, look, I got 80 women that I could send your way if you just take the course and talk to me and do things and know how to work things up, what a great resource that would be, right? And the goal here is to get physicians on board so that you guys don't have to travel anymore. Wish I would have found the group sooner. Me too. Well, it's okay. Sometimes things happen for a reason, and you just do the best you can. Sarah's going to give me a call. Thanks, Sarah. I appreciate that. But let's help women. If y'all have had it done and you had it done poorly, or you just didn't get the questions answered, what I think needs to happen, this would be great for me, is the problem with the current lists that are on each state website or on the Essure removal main page or the Essure problems main pages, I don't think that even though they try to update those lists, they're not very accurate. And I think that the doctors who are helping women, because there was a doctor in California that was taking them out and she was highly recommended. She called me one day and I asked her how she was removing them. And she's like, oh, I cut the tube and I pull them out. Completely not the way you should be doing it. But she had probably done 10. And was being referred by other women, and it's like, no, you can't, you shouldn't be referring patients to her because she's not doing it the right way. Good. Well, I haven't had anybody from Mississippi yet, so if you want to come see me, that would be great. Any other questions you guys have? What is the benefit to taking the medicine before removal? I think you said it was hormones. So, Tracy, what I tend to do, we know that the Essure coils are, they're neuroendocrine disruptors, and I'm seeing a lot of hormonal imbalances like estrogen dominance, progesterone deficiencies, testosterone deficiencies, and I think that I can get those hormones fixed right away within a few days of your first appointment. And a lot of women will feel better just changing their hormones around rather than waiting for 4 to 6 weeks or whatever it is that we can get the insurance approved and get you in for surgery. A lot of women then stop those hormones after they have the surgery. So it's not necessarily a long-term thing, but I think it's a good idea to at least look at them. Angela wants me to share what I've seen with improper removal. Gosh, I had a coil sewn into the top of the vagina. I've had multiple fragments. I've had one removed and they left the other one in. I had one woman who had a hysterectomy and they left the tubes behind with the coils in there. I mean, I'm seeing all kinds of stuff. I don't name names, but there are also doctors out there, because I'm reviewing cases right now, that are telling patients they removed the coils and they didn't. They have an x-ray after the surgery 2 years later and there's still a half a piece, or sometimes I had one woman who was told she had her coils removed completely. The doctor said he got them both and they were both still in there. So you really just have to be persistent. You have to be bulldog about it. You know, you want to get the right thing done the first time around. You want to go to the resources that are the best. You want to ask lots of questions. If you get any sort of a weird feeling, I would trust your gut. If you don't feel supported, I would go somewhere where you do. Janie, I totally agree with you. And Teresa, thank you very much. Or Trinice, thank you very much. What other questions do we have, ladies? Anything else? Has anyone complained of real bad heartburn or trouble swallowing food? That wouldn't be one of the more common ones I've seen. Usually pain, bleeding, painful intercourse, rashes, joint pain, muscle pain, autoimmune diseases, things like that. I never say that Essure doesn't contribute to anything, but it sounds like what you might have is gastroesophageal reflux, which could become from stress because you're not feeling good. And if the reflux gets particularly bad, it can make it hard to swallow. So, and that might be something that you'd want to see a gastroenterologist for, so that they could talk to you about maybe, looking in the stomach, see if there's anything going on there. As far as a belly binder goes, it's a personal preference. I think most women feel better when they have a belly binder. After the surgery, it just helps support the abdomen. But I have had a couple of women say that it drove them crazy. So everybody's a little bit different. I definitely would try it. Some women just feel better if they hold a pillow on their belly after surgery. But overall, most women tend to do really well and are well recovered within 2 weeks. Some take a little bit longer, some a little bit sooner. But overall, I think by 2 weeks, you're probably 80 to 90% back in, with your normal activities. What else? We're coming up on 35 minutes. I don't want to drag this out for everybody. The office phone, if you have any questions too, is right there, not 512-956-0296. Jenny answers the phones. If she's on with somebody else, just leave her a message and she'll get back to you. I know with a lot of people, they were having some problems with the phone. I think they were off by a digit, so that's the phone number. Here's the lovely Kimberly Harlow. Kim is the one that gets you guys good and ready to go. Kim's the medical assistant, and without Kim, my life would be miserable. Kim is wonderful. She's been working with me now for over a year. Amber didn't come with us when we moved, but Kim is awesome. So feel free to, and I included Kim's email a little bit earlier. Did I write about all of this in Sills' book? I did a chapter on Essure removal in Dr. Sills' book. It's about 17 pages, and what I covered in my chapter was my data, my Essure removal data, and what I think is the correct procedure. And yes, I did talk about my procedure in the book and went through it kind of step by step. Yep, Kim is amazing. You don't even know. Darn near perfect, if there ever was a perfect. Any other questions or comments about anything? Carrie says, just talked to Jenny today, so happy to get the ball rolling. I'll be traveling from Florida. Yes, Jenny. Thanks, Carrie. That's really great to hear. It's been tough over the last few weeks trying to get everything the way I want it. I know that they're trying their hardest to get you guys going. Jenny, have a great evening. Thanks for sharing. I appreciate that very much. How far ahead am I booked for surgeries? I'm probably doing right now 4 or 5 a week, but I'm about ready to open, and I have time available on Wednesdays. I'm probably 3 weeks out. We can always open more time if there's a need, but it's really just waiting on insurance companies. There's Jenny Little Stevens. She's awesome too. Jenny's new to us about 2 weeks ago. She joined on the 15th of May. She's been helping me on Facebook for a while before that, but she's now answering phones. She's learning a lot. She didn't come from a medical background. She's a marketer. So thanks for giving her time to ease on in, as it were. I think she's doing a great job, and she's a wonderful lady. What other questions do we have? Well, if there's no questions, I think I'm going to end because it's about 40 minutes and I don't want to lose people. What I'm going to probably do is put this on my YouTube page. Jenny will thumbnail it, and then we can post it to the YouTube page so that you guys can find it. I'll put links to that. You're welcome, Jeanette. And please, we're still smoothing out some kinks. I think it's going to get a lot better here in the next couple of weeks. We're going to get more streamlined. Probably 80 to 90% of the practice now is Essure. So we're really going to get this. Ball rolling, and I'll see you guys in the near future. Hopefully everything goes well for everybody. If you're not having surgery with me, I hope you get somebody that really can help you and does a good job. So appreciate the time, and remember www.removemyessure.com. If you could sign up, that would be great, so we can get the demographics and densities going, and we can really figure out where the women are right now that want to have this procedure done. If you can post this to your Essure main group pages and encourage women to join the Tassone Method, because I can really do more here than I can do on other pages, it would be really helpful. So thank you guys. Take care, and I will see you soon. Bye-bye.